I'm the executive director from ABC House, and I'm passing out the first papers that went around are specific to the requests that we made. I'm also going to supply you with brochures and other information if you want, so feel free. So I'm here to talk today about ABC House. We're the local Child Abuse Assessment Center, and we're referral only, and we provide a unique service to children from Lynn and Benton counties. We are the only center that does what we do. We have medical services, forensic interviews, counseling, advocacy, and then public education around child abuse. We work within a multidisciplinary team in Benton County, with both counties, but specifically in Benton County, that meets twice a week to staff children and their issues. And what is really key for giving a true coordinated response is having a medical provider who is an expert in child abuse. Dr. Shervinack has been working at ABC House and providing these services to children for 14 years, and she is the only person who has the breadth of expertise in the medical field. And that is critical to determining helping to determine child abuse, because there are medical issues that only someone with specific training is going to be able to decipher. And so she is a huge resource, not only to the children and families, but to law enforcement and DHS. And our workload has increased recently. Many of you may remember Carly Sheehan, who was beaten to death a few years ago. And because of that, Representative Gelser has been instrumental in getting further legislation to protect children, but it also increased our Dr. Carroll's workload in particular by about 120 cases a year. That's a good thing, because more children are being identified and getting the appropriate care. Tonight we're looking at a grant request that we made in the amount of $27,540, and I wrote this grant for key assessment services. I realize that funding is tight. ABC House has never come to Benton County in the past requesting services. We've been able to manage. We do hold a contract with the District Attorney's Office for services, but our costs and our donations are going down, and the cost of an assessment, which includes either or multitude of services, are medical exams, forensic interviews, and advocacy for the family. And part of advocacy is making sure they get crime victims compensation if there's a crime, and linked to other services such as counseling, housing, whatever. Those are the core services around assessment. And it costs an average of $915 per child, and that encompasses all of our expenses, excluding counseling and education. And we receive, through the funding with the DA's office and donations from Benton County, about $80,000, which comes to $510. We are short $405 for the children. We've requested money from the city of Corvallis for children actually from Corvallis. This request is based on children in rural Benton County outside of the city per child. One of the reasons we've had to come is we are expecting a cut in one of our major fundings of somewhere between 10 to 25% in our money, along with Oregon Health Plan payments we know are going to be cut, and over 65% of the kids that we see are on the Oregon Health Plan. And the only services that are income generating are our medical and our counseling. Everything else in our building is based on grants and fundraising and donations. So I am asking for your consideration to help continue to support the children who are suspected of being abused. I can tell you that not every child that comes to our building is abused, but that is part of the process to help determine if they are at risk or if everything is fine, and it appeared that way. It's a very traumatic thing for a family, particularly parents, to come to our building. The second piece of the request is for community education. When I first began, I saw that there was a big piece missing around child abuse in education for our children. We have children who live in abusive situations every day of their life, and they don't know that because it's normal to them. They don't know that these things are not okay until someone actually shares that with them. And one of the biggest issues that we've had recently is internet. I'm sure many of you have heard of sexting, of internet crimes. And so we have 3 different programs that we provide. The internet program is to middle school students, and that's fairly new. And I have to say our educator just booked Lincoln and Shelbyville, and that's a huge success to get into middle schools. And we're talking to them not just about internet, computer safety, but what is a predator? When you tell a young person in 7th or 8th grade, they don't always understand what that means. So we're really trying to explain that to them, help them truly understand it, and be able to protect themselves. Talk about sexting. What is it really like emotionally when you send nude photos of yourself and then it's all over Facebook and your entire school sees it? There are lots of repercussions to that. So we're asking them to be safe and helping them learn to be safe. We're also talking to high school students around child abuse. We have teen parents. We have children or high school students who are babysitting. We want them to be able to recognize that, to help support it, and to protect the babies that they have. We also have a session on dating violence and domestic violence, because dating violence is a very big thing, and it is not particular to male versus female. There are many females who are also abusive in relationships, and we want to teach these children or students, I can't call them children, how to have good, healthy relationships and how to remove themselves safely when it isn't a healthy relationship. That last year, Patty spoke to about 715 students. Now I will tell you that some of those students were repeat, because maybe we saw them in the fall or in the spring as freshmen and in the fall as sophomores, but it's hard to kind of distinguish that. It cost an average of about $8.35 per child per year, and that we are asking for help in that also. That is not a revenue generating program, and for us to continue, we have focused on children. We're going to be launching a program for adults, particularly adults involved with children, such as teachers and staff at Boys and Girls Club, daycare providers, and things to help them also understand child sex abuse. So I recognize that our request is large, but I'm asking you to really consider that for 14 years we've been providing services to children from Benton County. Those numbers have grown. We welcome that, and we want to make sure that every child and every family has access to the support that is needed during an assessment, because it's a very emotional, traumatic, and anxious time for families. And when we can send children away feeling, while they had to do something difficult, that they had a great experience, and their experience there is what really helps them move on to healing. So I'd open up for questions. I know this is so brief for such a large subject, but if anybody has questions for me?
How many patients or folks did you get referred to you from the district attorney's office?
From the district attorney's office? The DA doesn't typically refer. It's law enforcement and DHS. We do work as a team, and we staff and we meet at the DA's. They're part of that MDT, but we had 158 children from Benton County, that included Corvallis, last year, who were referred to our agency.
By some law enforcement agencies or something?
Law enforcement, DHS, or medical providers. Those are our 3 referral sources. We see Dr. Carroll's worked extensively with physicians to help them become better educated and recognized, and because she is the expert, they often refer patients for her as a second opinion. So we are referrals from 1 of 3 sources. Yes?
You said you don't necessarily track a patient from one semester to the other, freshman and then
Right.
become a sophomore. How do you track the success of your programs?
We do some post-testing surveys. around knowledge, pre and post-test knowledge of what they knew about the subject at that time, and then post-test afterwards. We have some, I think 8 question surveys that we do, and we get often notes from the children, I should say students, I'm sorry, I'm thinking about little kids, from students and from teachers, but we do some post-testing to measure how much information they have gathered from that information. Yes.
If I'm misunderstood, those aren't patients, those are
They're,
education sessions.
yeah, students in the high schools.
Students.
Yeah.
Yeah,
So,
students
that's
in the
quite
high
different.
school. Any other questions? Okay. Thank you very much for your time and your commitment to this. Enjoy this sunny evening.